Welcome to today's video lecture. Today, we're going to delve into a fascinating topic, superior vena cava syndrome. Before we start, don't forget to check out our website madeformedical.com for hundreds of more videos like this at the end of this video. The link is in the description. In this session, we will delve into the superior vena cava syndrome, including its definition, etiology, pathophysiology, clinical presentation, diagnostic approaches, and management strategies. By the end of this lecture, you will have a comprehensive understanding of SVC syndrome and its impact on patient care. So, let's begin. Let's start with what is SVC syndrome. Superior vena cava syndrome, SVCS, is a condition characterized by the obstruction or compression of the superior vena cava, a major vein that carries deoxygenated blood from the upper body back to the heart. In this script, we will delve into the definition, etiology, pathophysiology, signs and symptoms, diagnosis, and management of superior vena cava syndrome. Several factors can contribute to the development of superior vena cava syndrome. The most common cause is malignancy, particularly lung cancer and lymphomas, which can exert pressure on or invade the superior vena cava. Other potential causes include non-malignant conditions such as infections, thrombosis, blood clots, or benign tumors. The signs and symptoms of SVC syndrome can vary in severity, but often include facial swelling, especially in the morning, neck swelling and distended veins, edema of the upper extremities, cyanosis of the face, neck, or upper chest, headache, dizziness, or altered mental status, shortness of breath, particularly when lying flat or with exertion, cough, hoarseness, or difficulty swallowing, chest pain or tightness. The pathophysiology of superior vena cava syndrome involves the progressive narrowing or obstruction of the superior vena cava, leading to impaired blood flow and venous congestion in the upper body. The specific mechanisms vary depending on the underlying cause. In malignancies, tumors located near the superior vena cava can directly compress or invade the vessel, causing mechanical obstruction. As the tumor grows, it can further compromise blood flow, leading to increased venous pressure and reduced drainage from the head, neck, upper extremities, and upper chest. In non-malignant causes, blood clots, thrombi, can form within the superior vena cava, impeding blood flow. Infections or inflammatory conditions can also cause local edema and tissue inflammation, contributing to the compression or narrowing of the vessel. Diagnosing superior vena cava syndrome involves a combination of medical history, physical examination, and diagnostic tests to determine the underlying cause and extent of the obstruction. Medical history and physical examination. A detailed medical history, including the presence of malignancies or risk factors for blood clots, along with a thorough physical examination, can provide valuable clues to guide further investigation. Imaging techniques such as chest X-ray, computed tomography, CT, scan, or magnetic resonance imaging, MRI, can visualize the superior vena cava and surrounding structures, helping identify the location and extent of the obstruction. Biopsy or fine needle aspiration. In cases where malignancy is suspected, a biopsy or fine needle aspiration of the tumor or affected lymph nodes may be necessary to confirm the diagnosis. The management of superior vena cava syndrome focuses on relieving the obstruction, managing symptoms, and addressing the underlying cause. The specific treatment approach depends on the severity, underlying etiology, and individual patient factors. Medical management includes corticosteroids. In cases of inflammation or allergic reactions, corticosteroids may be prescribed to reduce swelling and relieve symptoms. Anticoagulants. If the cause is related to blood clots, anticoagulant therapy may be initiated to prevent further clot formation. Diuretics. Diuretic medications can help reduce fluid accumulation and alleviate edema. Interventional procedures include stent placement. In cases where the obstruction is caused by a compressive tumor, interventional radiology techniques may be used to place a stent in the superior vena cava, restoring blood flow. Thrombolysis. If the obstruction is due to a blood clot, thrombolytic therapy can be administered to dissolve the clot and restore normal blood flow. Radiation therapy or chemotherapy. Malignant causes of superior vena cava syndrome often require targeted radiation therapy or chemotherapy to shrink or eliminate the tumor causing the obstruction. In conclusion, superior vena cava syndrome is a condition characterized by the obstruction or compression of the superior vena cava, resulting in impaired blood flow and venous congestion in the upper body. Early diagnosis, prompt management, and addressing the underlying cause are crucial for improving outcomes and relieving symptoms. For more videos like this, please subscribe to our YouTube channel and visit our website madeformedical.com. Link is in the description. Thank you.